In April of 2008, I was diagnosed with lupus and rheumatoid arthritis. It was a fairly lengthy process and a lot of time of not knowing and being told that basically I could have nothing or I could be dying. So lupus is an autoimmune disease that impacts the major organs in your body, including the skin, and rheumatoid arthritis impacts your joints. Both are autoimmune conditions, which means that your body is basically mistaking your joints and your organs as foreign invaders and attacking them. They're both systemic, widespread illnesses and come with varying levels of disability. In my academic program, people were telling me that I should drop out of school. My rheumatologist was telling me that I should drop out of school. School was what I knew, and it's what I wanted to do, and it's what was familiar to me. And so when my doctor was telling me that I should drop out of school, to me it was like I had dreams and goals that didn't end with me getting sick, and this is what I wanted to do with my life. And I didn't want to drop out of school and move home and die. You know, I don't know what else I would have done. My blog is getting closer to myself, and when I first got sick and started blogging, I started meeting people online that were dealing with similar issues that I was, but one of the things I was noticing wasn't really out there was people talking about being chronically ill in college and graduate school. And for me, it was a huge struggle that I went through on my own, so I sort of shifted focus on my blog to focus more on that. The people that I've talked to with lupus and with rheumatoid arthritis, it's pretty common for people to not go to college or to drop out. And typically it takes chronically ill students longer on average to finish, and some don't finish at all. At Sarah Lawrence, I worked with lupus patients, and I created a resource for them and for their doctors about going to college and dealing with all of that. I had a student come to me when I was teaching who had had thyroid cancer and was having a yearly scan and wanted me to know that she was nervous about it and that her work might decline. And I asked her if she had filed with the disability office, and she hadn't. And so I printed the form off and I gave it to her, and she started crying. And she said, "Nobody has really done anything for me. You're the first person to do that." Chronically ill students are really on the margins. And one of the things I would love to see in institutions of higher education is a patient advocate.